So today we're going to see about short stature in children. Um, short, short stature in children. So today we're going to see about pediatrics, pediatrics, pediatrics about short stature in children. Short stature in children. So the short stature in children is divided of two types. Case of divided of two types. One is physiological, next one is pathological. So what is physiological? First we will discuss about physiological. What is physiological? Physiological is nothing but height is less than 2 standard deviation below normal. Okay, and physiological is nothing but first point is height is less than 2 standard deviation below normal, and second point is here the growth velocity is normal. Here the growth velocity is normal. Here the growth velocity is normal, and so the growth velocity is normal does not, it means that the growth is normal here, but due to the genetics and his familial history, the patients are short. So it is divided of two types. The physiological is divided of two types. Okay, physiological is divided of two types. First one is the familial stature, which is due to familial stature, and next one is the constitutional delay. Constitutional constitutional delay. So in the first 2 years, the growth is slow, and then the normal growth. Final height will be short because in the first 2 years, slow in growth, they can cover up the growth is family stature. And here the history of short parents is noted, and finally if your parents are less than 152 centimeter, both your mom and father, you have the possibility of to be a short child. And here the bone age equal to chronological age, which means the bone age is normal with the chronological age. What is bone age? Bone age is a X-ray classification of bone classification center, and then calculate that age is called bone age. Okay. Here, what is family stature? First, we will check about family stature. Here, in the first, you all know that first 2 years, the growth velocity is higher. In this period, the growth is going to slow down. So the height patient height is also low, due to in the first 2 years the patient the growth is slow, so the patient height is also slow hence short short in nature. This is due to nature. If the parents are short, uh, the baby is also going to short. And but but after 2 years after 2 years there is normal growth. uh, normal normal growth after 2 years, normal growth. So but due to this delay in the first 2 years, the patient cannot cover up the height which is takes place in the adolescence period, so hence the patient is going to be short. And we can see short history is family history of short parents. And here, important point, bone age is equal to chronological age. Chronological age. Bone age equal to chronological age. So what is a bone age? Bone age is a X-ray. We take X-ray. We are going to find the ossification center and then calculate the age. This is known as bone age, which is going to um, similar with the chronological age. But what is constitutional delay? Constitutional delay is nothing but what is constitutional delay? Same, same with the constitutional delay due to uh, some malnutrition or nothing but malnutrition. The patient is going to slow growth in the first 1 to 3 years. After that, the patient is going to grow faster to cover up the cover up the last growth last growth which is in the first 1 2 years. The patient is going to have slow growth, but after that the patient is going to grow faster to cover up the last growth which is lost during the first 2 years. You all know that in 1 to 2 years is the uh, we will grow more, and then during the adolescence period we will grow more. In this patient, the patient is going to uh, not grow in the 1 to 3 years, but he's going to cover up the portion which he lost growth during the 1 to 2 years in the adolescence period. Family history of and here you can see the important history, family history of delayed puberty. Family history of delayed puberty is noted. Delayed puberty is noted. So, and most common cause of short stature is most common cause of short stature, most common cause of delayed puberty. So this is the most common cause of short stature. Short stature, most common cause of cause of delayed puberty. We all know the delayed puberty. So this is constitutional delay. This is the most common cause of height short stature in the worldwide. Okay, but and here here the bone age does not correspond. Bone age is less than the chronological age. Okay, bone age is less than the chronological age, but here the bone age is equal to chronological age. So that's all. Next we are going to see about the pathological cause of short stature. What is pathological cause of short stature? What is due to pathological cause of short stature? Pathological cause of short stature. Short stature. So here we are going to divide it into disproportionate, proportionate, and proportionate. Proportionate, proportionate. And here the upper segment is more, and the lesser segment um, is low. So a simple logic that uh, cephalocaudal cephalocaudal. So when we grown up, the head size is more during the birth, but after when we mature, the head size uh, is similar to that of the lower limb and upper limb. But when we have birth by birth, our upper segment which is more when compared to our lower segment. So these patients, their upper segment will be more, their lower segment will be less, or their upper segment will be more and the lower segment will be less. This is known as, so this is a patient, you can see big upper segment, but lower, big upper segment but lower segment. This is disproportionate, and you can see the patients having less upper segment and more lower segment. This is disproportionate. This is due to caused by CAR. A simple mnemonic is CAR, which is nothing but congenital 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 hypothyroidism, congenital hypothyroidism, and achondroplasia, chondroplasia, chondroplasia, and nothing. The next one is the recus. So, how to remember this? Disproportionate patients unable to walk with the feet, so they will use car. So, this is congenital hypothyroidism, chondroplasia, and rickets. And here the upper segment is 1.7 so upper segment is 1.7 more than the lower segment in birth. Okay, then the upper segment is in 3 years 1.3 times more. Upper segment is more than lower segment, but after 7 to 10 years this is going to be normal. This is for the normal patient, but here this is disproportionate, so there is some disproportionacy in this short stature. Next one is the proportionate short stature. What is proportionate in the meaning? Which is the both upper segment and the lower segment is going to grow with normal, but this can be due to causes like how to remember feet. The mnemonic is feet. Here the proportionate short stature, which is the upper segment and lower segment, is normal. They can walk in the feet. Okay, so this is a patient who is short in stature, but the upper segment and the lower segment is both normal in size, so the patient can walk normally in the feet. Okay, normally in the feet. What is mnemonic of feet? First one is F, food. Food. F, food. Food just due to improper food, that is malnutrition. And endocrine, next one is the E, endocrine deficiencies like endocrine deficiency like growth hormone deficiency. And next one is the extended diseases like chronic diseases. Extended diseases like chronic diseases. Any chronic diseases. Example like chronic diseases like chronic kidney disease and chronic kidney disease and chronic kidney failure, like that. Okay, and next one is the Turner syndrome. Turner is a chromosomal disorder, right? So other chromosomal abnormalities also. Abnormalities. Other chromosomal abnormalities. And what are the chromosomal disorders which can cause this proportionate short stature, which is going to be mnemonic TNDPRS. TNDPRS. And how to remember this? First one is Turner. We all know Turner's. Okay, Turner's syndrome. Turner syndrome. So these all are syndromes, chromosomal abnormalities. Next one is the Newman syndrome. And next one is the Down syndrome. We all know Down syndrome. And Prader-Willi syndrome. And next one is the Russell-Silver syndrome. And next one is the Seckel syndrome. All give syndromes important cause of short stature in chromosomal abnormalities. Okay.